Good afternoon, everybody. Welcome to this session. First of all, I'd like to wish you all a very happy International Women's Day. I, Dr. Asavri Sawant, on behalf of Voice of Healthcare, welcome you all to a very special conclave, Better Her Health, a 360-degree focus on women's wellness, organized by Voice of Healthcare and powered by Zydus. In this second edition of our International Women's Day celebration this year at VOH, we are doing this year's initiative is to mark the celebration by conducting a day-long dedicated event with many eminent speakers from the field of women's health, wellness, leadership, and empowerment, who are all working towards the same goal of bringing women's health and wellness in focus. For this very special episode and live panel discussion, we are focusing on rebuilding, repairing, and refilling the health necessities of women. Let me begin this session by asking all our viewers, what is women's health empowerment according to you? To answer this question and take it further, let me call upon some very eminent people from this field. I welcome Ms. Urvashi Prasad, who is the Director in the Development Monitoring and Evaluation Office at NITI Aayog. Welcome, ma'am. Ma'am, it would be great for us if you could turn on the video during the session. Thank you. Next, I'd like to welcome Dr. Manasi Shah, who is the consultant medical oncologist at HCG Cancer Center in Gujarat. Welcome, ma'am.
Thank you.
Next, I welcome Dr. Sudha Sinha, who is senior medical oncologist at Care Hospitals in Hyderabad. Welcome, ma'am.
Thank you.
I would also like to welcome Dr. Bhawna Sirohi, who is the lead medical oncologist at Apollo Proton Cancer Center in Chennai. Welcome, ma'am.
Hello, everyone.
I also welcome Ms. Sheenu Jhawar, who is the director of Apex Hospitals and founder and director of Ace Vision Health Consultants. She is a maternal mental health researcher and a charter member of TIE Rajasthan. Welcome, ma'am.
Thanks very much. Pleasure to be here amongst this august gathering.
Thank you. So let us go further and discuss some eminent topics that are going on related to women's health. So, ma'am, Dr. Manasi Shah, ma'am, my first question would be to you that when talking about healthcare for females from your practice, which areas do you feel require the most attention towards rebuilding, repairing, and refilling the health necessities? Which areas do you feel we need to focus our attention the most on? Is it prevention, treatment, accessibility, or what? Please.
So if I can just start off the session saying that I think all of the ones that you mentioned are extremely important. However, if I were to focus on a few, I would start off with prevention. So if you're looking at women's health, especially in oncology, uh, breast and cervical cancers, as well as at least in the western part of the country, head and neck cancers are one of the most common cancers that affect women. And if you look at these cancers, for example, cervical cancer, it is a totally preventable disease, but most of us, or at least most of the people, don't know that. Breast cancer, again, to a certain extent, is preventable, but at least through early detection is easily curable. And head and neck cancers, especially in the western part of the country, are mostly related to tobacco and smoking. So, all these cancers do have preventive measures that I think we need to make women aware of. And I think preventive strategies are not in place best as they could. So, that is something that we could definitely focus on. The other thing I wanted to talk about is affordability. So if we look at oncology, a lot of treatments are financially taxing to the family, and financial burden is great for the patient as well as families. If we look at the statistics, for hospitalized patients, the family almost spends 40% of their total annual savings on healthcare, and more than one third of this savings is achieved by either borrowing from relatives or selling assets to cover medical care. This does not take into account the earnings that patients or family members lose because they cannot come to work or because of transportation issues and other issues. So I think definitely we can focus on these two issues, especially because we know that a lot of women are not the primary bread earners for the family. And so I do come across patients and families where a lot of decisions are made, maybe not in the best interest of the patients, but maybe in the best interest of the financial capabilities of the families.
I completely agree, ma'am. Very rightly said that if we are able to first and foremost focus our energies towards prevention and early detection and then to affordability, we would have so much better progress and success in eliminating this disease. My next question would be to Dr. Sudha Sinha, ma'am. What areas of women's health access and healthcare, from your experience, do you feel there is a growing need for tackling gender inequality? Which areas do you feel gender inequality persists in healthcare?
Okay, I think we all know that gender inequality is there in healthcare. It's a well known fact and published quite a bit that women have less access to healthcare in all fields. So, if you see, there are more men in the OP, there are more men in our inpatient wards. So, the access to care is less. Now, coming to cancer and healthcare access, starting from childhood, and I've worked a lot with childhood cancers. You see more boys than girls who are receiving treatment for childhood cancers. The number of treatment abandonments we see are more in girls. Refusal of treatment is more for girls compared to boys. So, right from childhood, this gender inequality exists and it carries on to adulthood. In adulthood, it becomes even more complex because of the misconceptions that are there with cancer. So, a lot of people think that cancer is something that is contagious. Women worry that if they say they have cancer, then maybe their children will not get married. Maybe they have to move out of a rented house. They will lose their hair with the treatment. They might lose their breast with the treatment. So, all these are barriers to even access care. To come out and say that you have a problem, there are so many misconceptions that exist about cancer, and these become barriers to access healthcare. And once they access healthcare, like Dr. Mansi was saying, affordability is a very big issue. Decision making, women are not given a lot of choice regarding their treatments, and I think we'll be talking about that later. And in the public hospital setting, where you're not able to voice any of your concerns, when you're sitting in an OP where there are three patients along with you, or in a general ward where you're not able to tell or talk about any of your problems to the doctors. So once, even if you access health and finally reach it, you're not able to make decisions about your care, you're not able to voice your concerns. What is most important to you, to anybody in the healthcare field, just the way our hospitals and our infrastructure is designed.
Definitely, ma'am. Thank you so much. You have pointed out so many great barriers to healthcare that we see around women and around patients in general. Going forward with the point which Dr. Manasi Shah pointed out of affordability, my next question would be to Ms. Sheenu Jhawar. Ma'am, what can we do to have affordable quality care which is accessible to all, in your opinion, and especially to those who live in less developed cities such as tier 2, tier 3, and such cities which do not have access to specialists very readily? Ma'am, what is your take on that?
So even before I come to the affordability, we have to understand that when you talk about access to health, the first fundamental issue is the awareness of the problem. The problem is that women in our country, and especially when you talk about tier 3, tier 4 cities, and a lot of people also in the rural turning to urban areas, territories, they're not even aware about the health issues which are pertinent to women. You would be quite surprised if you just look at the most common diseases which affect the women. heart disease is very important. And again, if you look at the data, which I have right here in front of me, you would be quite surprised to know that men and women have difference in biology, because of which women are more prone to heart diseases. Because when you look at their cardiovascular system, compared to men, women have smaller hearts and narrower blood vessels. So imagine the cholesterol build up there and how they are more affected by the heart diseases or prone to heart diseases. They also, like I said, they have different places where the cholesterol buildup happens. They have different symptoms of a heart attack. They have different risk factors for the heart attack, and they require different diagnostic tests itself. The diagnostic test for men and women for heart disease is not the same. But how many of us educated women are also aware about these facts, let alone people in the tier 3, tier 4 cities? So do we have enough awareness generation about the problems in women before we talk about affordability or accessibility? Breast cancer, ovarian cancer, cervical cancer. Again, you would be surprised when you talk to women about cervical cancer, most of them will relate it to the cervical bones. We do not understand what that relates to. Cervical screening is not rampant in this part of the country. Perhaps it is down south. Stroke. Women are at a much greater risk of stroke compared to men. Diabetes, the urinary tract infections, osteoporosis, autoimmune disease, and the most important of all, which I'm very, very passionate about, is the mental health or depression in women, especially during the antenatal period, where it is confused with a lot of other symptoms, and also in the postpartum period. So, the first part is to generate the right awareness amongst the medical community and the women. And the second part is to create the access for them to avail the services now that they are aware. So, we are doing a lot of stuff, and I personally believe, and so does my organization, that the only way to get to these people, these women, fast is via digital health. Because you cannot have the brick and mortar resource generation or execution in a short period of time. So you've got to address the problem by reaching out to them digitally. That is the only way possible. The government has come out with many schemes to make it affordable, but I think before coming to that bridge, we have to look at all of these things to really make it impactful. So that would be my take on your question.
Thank you, ma'am. That was so aptly put and very strongly said. And we all are already aware that there is so much lack of awareness about health issues, even for educated women to begin with, let alone people who are less educated. And generating more and more awareness and access would also would help us so immensely, and digital health, of course. We would get back to you again for discussing more on maternal mental health topic in the next round. But to take it forward, my next question would be to Dr. Bhavna Sirohi, ma'am, that we have read so much that self breast examination is a good awareness generation tool, but clinical examination is the gold standard. So what is your take on the same, for a country like India where we have such huge population? And and can you please touch upon the different breast cancer screening methods that are easily available? Also, what would be the guidelines present for breast screening for females at different age, and what would you recommend in your practice? What screening guidelines and everything, ma'am, please. Yeah.
Thank you, Dr. Sawant. And first of all, thank you for organizing this and doing this, because I think on this Women's Day, it's very important that we empower women with the information, not just educated, uneducated, but everyone. It's important. You bring out a very good point. I think it's very important for every woman to know what is normal for them, because unless you know what is normal, you will not go and seek advice for if you develop a lump. So I recently saw a lady whose one breast was bigger than the other breast, but she's always had one breast which was bigger. So this may be normal for you, but it may also be sign of a very early cancer or advanced cancer. You may have a nipple which is inverted. You may have a change in contour of your breast, change in the nipple discharge, or there's a new lump. So all of these could be signs of breast cancer. Not all lumps in breast are cancerous, So a lot of us have fibroadenomas or fibroadenosis, which is not cancer. So it's important to know what is normal for you. So I think self-breast examination is a very important tool to be not only aware, but also know what is normal so that you can seek advice at the right point. So if there's any change in your breast, or for that matter, in your body, anything that is not normal, you must take advice. Clinical breast examination, which is done by a trained professional, a trained healthcare worker, is a very important tool in detecting cancer early. So there was a huge study from Tata Hospital which did show that, if you even once a year, if you go and have a clinical breast exam, it does save lives and detects cancers early. So the government of India has a fantastic program, where they've started clinical screening for women and men aged 30 years and above, for a breast examination, cervical, cervix examination, and also a mouth examination, because head and neck cancer is also very common in our country. So I feel that all these CHCs, PHCs, the population should avail access to this. So clinical breast exam or a clinical exam for early detection of cancer, I think for a country like ours, which is resource limited, is very, very important. So various modalities which are, I would say, standard of care for screening for breast cancer are mammogram, which is an X-ray of the breast, which can be done with tomosynthesis in younger women, age between 40 to 45, or I would say even 50 years of age, because younger women have dense breasts, so sometimes mammogram may miss cancers. So it's important to maybe add tomosynthesis or maybe complement that with an ultrasound. But in most countries with coordinated screening programs like UK or Europe, a screening mammogram is done from the age of 47 years onwards. It used to be done from the age of 50 years onwards, but there is data that it can be done from 47 onwards as well, every 2 years or even annually. If there is a family history of breast cancer or ovarian cancer, which is strong, or pancreatic cancer, sometimes we may recommend that the patient starts having an MRI scan of the breast. So we do MRI scans and abbreviated MRIs as well, which is a shorter duration of MRI scan once a year in those ladies. So mammogram, ultrasound, MRI scan, these are the main modalities which may be done for breast screening, but discuss with your physician which would be the best modality for you. Mammogram is the standard of care from 50 years onwards. The guidelines, there are various national and international guidelines. We have ICMR national guidelines as well, which one can look up to, and also international guidelines that we do look up as well. What I normally recommend in my practice is that I recommend that most women learn to do a self breast examination. They do go for a clinical breast exam, and if there are resource limitations present, I would say from the age of 50 years onwards, have a mammogram every 2 years. But if there are no resource limitations, I would say have a mammogram which is digital if possible. Digital because the quality of image is better, and also one gets less radiation. So so all of these things are important. So this is what I would recommend in my practice. I think most important thing I say is be breast aware.
Great, ma'am. Thank you so much. Being breast aware, definitely. And as you aptly explained to us, that not just breast cancer, but getting screened for cervical and head neck cancers are also very important, starting from the age of 30 years at least. And if the resources are limited, the self breast examination is definitely the way to go, if for regular things. My next question would be to Miss Urvashi Prasad. Ma'am, are we audible? Yeah, okay, we can hear
Yes,
you.
yes. Yeah.
Yes. So the question would be that according to WHO, I read somewhere WHO 2013, the health literacy and health education says that the cognitive and social skills that determine the motivation and the ability of people to gain access, understand, use information to promote and maintain good health is called health literacy. What, in your view, is literacy? And does health literacy mean the same as literacy and health? And what all yet needs to be promoted in health education in the Indian female population?
Yeah, thank you. Thank you, firstly, for having me here, and apologies for the technical challenges at
No
my end.
problem, ma'am. We
Um,
understand. Yeah.
yeah. So yeah, so I think it's a very very important question, and I think especially so in the Indian context, because there is so much diversity. When we talk of India, we know that it's not one country really that we are talking of. There are so many diversities within, and it's almost like many countries in one. Each state, and within each state, there are so many differences. So even when we talk of health literacy or health education, I think all these differences obviously come into account, and they play a very 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 big role. So I think we have a very very long distance to go in terms of making, first of all, our population, and I think that's men and women, I would say, because women's issues, I think it's equally important that men are actually aware, and are able to have those conversations with with the women in their lives. So I think we need to do a lot. Obviously, there are plenty of success stories. There are plenty of programs and initiatives where we have been able to communicate effectively. There's vaccination programs. We've had a good communication around some of those, and even some successes that we've had in the recent pandemic in terms of communicating about behavior change and why we need to adopt certain behaviors. But there is a lot that we need to do to actually get this message out in a very localized fashion, in a manner that appeals and resonates with women across the country, in different languages, keeping different socio-cultural contexts in mind. We have elements of caste and religion, and so many other intersections when it comes to this. So I think that is where we really need to do a lot more work, and that is where governments, and when I say governments, I mean not just the central government, but obviously state governments, and actually at the much more localized level, right down to the district and the block, and the panchayat and the urban local body level, need to engage with the local stakeholders, the local community influencers, local sort of opinion leaders, whether it's the panchayats, whether it's others in the urban context, and of course civil society, student groups, volunteers. There's so many, and we saw a lot of them come to the fore during the pandemic. But it needs to happen on an ongoing basis, and we need to push out the education that we do through these networks, so that it is actually relevant to women wherever they are, to women and to men. Also, I feel that we need to make it a two-way process. It's not just us pushing out information about health or diseases, but really make it much more engaging, much more interactive, so that we can also get feedback in terms of what's working, what's not working. Often I think sometimes the health education information sharing can feel quite one-sided. Even when I've spoken to communities, they often feel that it's just a lot of information that sort of comes your way. But how do you really make sense of it? How do you engage with it? How does it impact your life? So I think it needs to also be a lot more interactive, and a lot more engaging, and I think simple. Not something which people can understand, like I said, where they are and in the context they are, and also bring in a lot more of the well-being aspect. I feel that some of our communication has tended to be limited to specific programs or schemes, or like for polio we might have a campaign, or for something else. But I think we need to talk about health and wellness much more holistically for women, and what that means. And that also includes so many other elements, whether it's mental health, whether it's other facets. So I think all of that also needs to be brought in, and to be able to do that, we really need people from a public health background, to work alongside the medical fraternity. We need people who are actually experts in this kind of communication and this kind of behavior change, to be able to really make this kind of communication effective. So I think there's multiple things here that we need to do. We should certainly learn, the lessons that we have from different states across the country, build on them. But there are definitely a lot of major steps that we need to take, and also really build those networks and partnerships of stakeholders to be able to really strengthen our health education and health literacy efforts. So I'll stop here. Thank you.
Thank you so much, ma'am. That was very detailed, and I completely agree with all that you said. Uh, my education, my master's is also in public health. So, all the points that you have mentioned, that the health education policies that we come up should focus on from the grassroots levels itself, should be localized and should appeal and resonate to the local culture and the background of people, and also focused on not just eliminating the disease and making people aware, but also on holistic health and wellness overall. I definitely agree that this would be the future of the health policies and health literacy for our country. Next, moving on, my next question is to Dr. Sudha Sinha, ma'am, that what are the commonly observed perceptions and knowledge that you come across in your practice for patients regarding cervical cancer and its screening in Indian female population? And what are the most common barriers that you observe in your practice regarding cervical cancer screening? Are there any taboos or anything going around this issue that you come across? And if so, then how do you empower those females to eliminate such barriers and focus and prioritize their well-being above everything else? Yeah.
Yeah, thank you. I think in a way it's a very easy question to answer because there isn't much awareness about cervical cancer. There's not much to say there, and not many people know that they need to get that cervical cancer is something that can be easily detected, it can be easily prevented, and it can be easily treated also. So the knowledge is just not there, the awareness is just not there. Now, as an oncologist, we don't see many patients where we are looking into the prevention or the early detection part. That would probably be more what the pediatricians and the gynecologists would be doing. But I would like to say that in my 15 years of practice, I can count on my fingers the number of patients who had an early detection and therefore came to me for treatment. It's been patients who had white discharge, who had bleeding, who had back pain, and have come with later stages of cervical cancer. So early detection of cervical cancer is something that we are still lacking in. Now there are two ways of looking at this. One is, what do I do with the women who come to my clinic? As a gynecologist, as an oncologist, what is the screening guideline that I can give them? And the second is, what is it that we can do from a public health policy point of view and implementing that? And if we want to see a decrease in the cervix cancer incidence in our country, and if we want to see an improvement in the cure rates, it has to be done in a very large scale, considering that 50% of our population are women and we are all prone to getting cervix cancer. So that kind of a public health policy which can be implemented is very much needed. So we have, fortunately, now in the public health field, because of the Arogyasri and the Pradhan Mantri Yojana and all that, at least an access to care. Once you are diagnosed with cervix cancer, there are places where you can get the chemotherapy, radiation, or surgery. But detecting them at an early stage where it is going to make a difference to their survival and to the country as a whole, I think that is where we are really lacking in having very robust screening programs on who should be doing the screening, how do we follow up these women once we screen them, how often should we be screening them, what are the tests that we should be doing, So Government of India has guidelines on this, but the implementation unfortunately has not been up to par for various reasons, good and bad. So I think these are the things that we need to be focusing on if we have to get a grip on the cervical cancer and decreasing mortality from that. Second is the vaccination also, and again, how do we afford the vaccines? Where, how many doses should we be giving? All this is open to discussion, and there should be guidelines so that we know how best we can tackle this issue.
Thank you, ma'am. That was very nicely explained. That I definitely generating more and more awareness regarding this issue is of paramount importance, and screening and vaccination should be, the priority. Moving forward, my next question would be to Dr. Bhavna Sirohi, ma'am. Ma'am, in your personal practice, what sort of inequalities and inadequacies do you observe in imparting complete breast cancer care in the complete breast cancer care ecosystem that we have in India? And in your observation, if we were to spread our voice to health authorities at higher level, what would be the one or two things that we would want them to pay the most attention on?
So I think that's a very good question. And the inequalities are there both on the patient side and I would say the doctor side, because even I would say that for women oncologists, there are groups for women for oncology. To get the voice on the table is also very difficult. And so I think this is the first thing we need to work towards that. But just coming on to the patient, there are huge inequalities, and that may be related to finances, to topographical access or access to care. Where a patient lives decides how long they are going to live. So, in Northeast India, the 5-year survival for breast cancer is 25%. In the rest of the country, it's 60%. Why is that? We must change that. And even 60% is not good. It's in the Western countries, it's 85 to 90%. So why are we so much way behind in a common cancer that the predictions are 1 in 5 of us will get it? Right now, the incidence in urban India is about 1 in 20, 1 in 25. And so I think we really need to do as a society, including work with the government, work with all the key stakeholders, including the NGOs, I think, who are doing a great job in changing this paradigm and improving the survival. I mean, it won't happen overnight. It'll take time. But to do that, the first thing we have to do is publish our results. Transparency and accountability is very, very important within our ecosystem. I mean, if you don't know what your benchmark is, how are you going to improve upon it? So for each cancer center to be called a cancer center, they must publish their results. They must tell us how many patients have lived for 1 year, how many patients died after 30 days of treatment, and if they died, why did they die? How many presented with curable cancer? How many presented with advanced cancer? There are certain, it's all well written, well established. We don't need to reinvent the wheel. These are called as KPIs, key performance indicators. If you were in a corporate sector, you would be asked for your KPIs. Why aren't the cancer centers being asked about it? And I mean, not just the government centers, but the private centers as well. So I think it's very important that we have transparency, accountability, so that the patients also know what the results are. In UK, I think the best thing I loved about the NHS is the transparency. Each trust got brownie points for, publishing their results. If there was inadequate, let's say, surgery, or the surgery was suboptimal, the surgeon was sent for retraining. So, there was some way, there was peer review. So that peer review process is very, very important. So the teams will yield good results. For anybody to treat breast cancer, it's important that the radiologist is trained well in reading the mammogram. The pathologist is trained well. The external quality assurance of receptor status, ER, PR, HER2, which decides 10 years of patient's treatment, is very important. medical oncology, radiation oncology, surgical oncology. All of us have to work together to, deliver the best care. Teams win championships, individuals win matches. So I think I think Roger Federer said that, or somebody. So, it's very important that, the team spirit, the multidisciplinary team meeting is very important. So every cancer patient, when they're diagnosed, it should be mandatory that they are discussed in an MDT and the MDT decision handed over to the patient. So, which again is lacking, and not only in our country, but in the West as well. Education, awareness, I can't say it enough. And I think what you're doing is educating and creating awareness. And I feel very privileged to be part of this program, because I feel that we have to empower people to, by doing these kind of events where, we increase the awareness level about the breast cancer itself. A coordinated screening strategy, I think, run by either the state government or the central government. I think the private hospitals do what I call is opportunistic screening, which is fine. But, I feel that one patient ends up going to 5 different centers. So, if you have some kind of a protocol-based treatment, which is guided by a body, like, you have various bodies in the West, in each country. I think that will actually improve our results, because it doesn't matter whether the patient is treated in one center or the next center, they will get the same treatment based on their stage. We don't need to reinvent the wheel. We know how to treat stage 1, stage 2, stage 3 breast cancer. We just need to make sure that it is protocolized and implemented across India. And early diagnosis with a coordinated screening program, I think, will shift the needle by, improving our survival rate, because most of the patients I see in my clinic are in advanced stages.
Yeah. Definitely, ma'am. There was a wealth of knowledge that I could hear from you. And not just focusing on screening, but as you rightly pointed out, having transparency into the data that we collect every day, not just from the health authorities, but also from hospitals and other health organizations, is very important for devising future public health protocols for this country. Also, focusing on training of different specialists and having a coordinated screening strategy is a must. So, moving on, my next question is to Dr. Manasi Shah, ma'am. Ma'am, I read it in a health journal recently that 60% of the cancer patients are actually being treated by non oncologists, and there are about so many oncologists to 1.2 billion population in India. As a result, most of the patients, approx 60% patients, are actually being treated by non specialists. So, please share your thoughts on having a standardized treatment protocol in oncology, and would that, in your opinion, help in paving the way towards health equity and of the treatment delivery in our country? Ma'am, what are your thoughts on this one?
So I think this is also another very important question, because I think most of our cancer centers are concentrated in urban areas, and the rural areas are kind of left with very poor access to specialized centers, especially cancer centers. I was actually just reading, there was a study which showed in rural Rajasthan that private providers, like healthcare providers, less than 40% of them had a medical degree. There was a high absenteeism amongst the healthcare workers that were sitting at the rural health centers or the urban health centers. They had limited hours of working, limited availability of drugs, of surgical skills, of equipment, and poor physical environments, and just poor provider training and level of knowledge. So I think before we kind of talk about standardized treatment protocols, I think the kind of workers that are there in the rural areas, they need to be looked at again. And now, especially not just allopathy, but we also have a lot of alternative medicine healthcare providers with no training as such for providing treatment to cancer patients. So, we do get a lot of cancer patients who come from the rural areas that have been uh, trying to treat their illness with Ayurvedic or homeopathic or acupunctures. and they come to us really with a very poor state of health. So I think that needs to be understood at the government level as well, because I think they've been given some authority to treat these patients. So, in terms of standardized treatment protocols, I think they would work best at the preventive level. So, as we have discussed so much during the last hour, how prevention is probably one of the most important things that we can do for our oncology patients, because a lot of cancers are preventable. So, having standardized treatment protocols for those, I think, would make a lot of sense in terms of who should we be screening, from what age we should be screening for what cancers, and how we should be screening them. I think standardized treatment protocols for those screening programs is definitely something that we can work on. And in terms of treatment, so I think that would definitely need a lot more coordination between the rural and the urban or the tertiary healthcare centers. The one good thing that COVID has brought about is I think a lot of us are now virtually savvy. So if patients cannot have immediate access, physical access to these big hospitals or cancer centers, I'm sure there can be some liaising between these rural urban health centers with some cancer centers that are in the nearby vicinity and the doctors, where they can provide some information on how to go about investigating, or what treatment can be given at their level and what cannot. Once the patients get treatment, they can go back, and there can be protocols for survivorship. So, if patients get diagnosed and treated at an early stage, they're going to hopefully live for a longer period of time, and we might be saving on cost as well as access to healthcare by giving them treatment protocols to see how to follow up, how to survey these patients, and what are the red flags for recurrence and stuff like that. So I think treatment protocols per se, in terms of providing for surgical care, providing for medical oncology care or radiation oncology care in rural areas, I think might be a little bit difficult because of all the issues that I mentioned earlier. But definitely in the preventive and the survivorship care, I think it could be put in place.
Definitely, ma'am. Now, as we are really short on time, my next question is to Urvashi Prasad, ma'am. Ma'am, can you please quickly touch upon your thoughts? How can we have more transformative approaches for improving female healthcare? For example, these days after COVID, we are getting on to digital healthcare. Other than this, what do you feel is the future of health policies and health development in India?
Yeah, wow. I mean, that's a really big question. I could speak on that for a very long time. But yes, as you said, you have
Just
very
very
less
brief
time. So I'll
points.
just,
Yeah,
yeah, I will
yeah.
just speak about it very quickly. Yeah, on digital, I mean, I would say, yes, digital is a great enabler. But, digital obviously is not a substitute for anything that we need to otherwise do to strengthen our health system. And moreover, in a country like ours, there's also a digital divide, that we need to address. So I think, yes, we must use technology to bring about the efficiency, bring about scale, reach out to people. But we should be aware that, obviously it's not a sort of substitute by itself. It's an enabler. So yeah, I think in terms of health system, there's just a lot that we need to do. But I think a couple of things that I would just highlight. One is on the actual health workforce, because I think we've been speaking about it also, in terms of specialists and doctors, how we need more of those. We also need better distribution, because the distribution across the country, rural, urban, remote, tribal areas, it's very inequitable. So of course we need that, but I would again emphasize that we also need to focus very strongly on our public health workforce, because we have not really systematically thought of that. Most states don't actually have a public health cadre. There's very few who do, and generally the ones who do also have actually had better outcomes to a great extent. So we really need to look at our public health system very, very systematically. from all levels, not just piecemeal, few ASHA worker or A&M related interventions here or there, but really looking at building it up right from the grassroots, right through every level of care, so that they can work alongside, the doctors, alongside the specialists, and perform a very very wide range of roles that they actually do in many other health systems across the country. So I think the health workforce is really one very important point. And I think the second one obviously is in terms of access, because even awareness or education, it's only as good as the access that we can provide. And there are a lot of inequities still there. We're trying to address some of it through taking health facilities to our tier 2 and tier 3 cities and towns, in partnership with the private sector as well. So I think we need to focus a lot more on all of that, the physical infrastructure, but very very importantly our health workforce, because just having these health centers or these hospitals without the requisite workforce and training and supplies will obviously not work out. So I think I would just say that a very strong public health approach, to go alongside whatever we need to do to strengthen our medical system, is really what we need to do going forward. Thank you.
Definitely, ma'am. Very nicely summarized that not just medical and health specialists, but them together with public health specialists would definitely help us in great extent. My next question would be to Ms. Sheenu Jhawar, ma'am. Ma'am, while your work with female mental health and maternal mental health, what areas do you identify that are that still require efforts from our side for empowering more and more women?
See, you would be very surprised that my research results are that I did a sample on 348 women representatives of the sample pool that I was looking
Hi,
at.
have you been missing? Hi.
Yeah. So I actually came to discuss, we emailed this, I came to discuss that
You may want to mute.
for VC.
Acha, okay. nahi, I am just on a call.
Yeah. And
Yes, ma'am.
the
Yeah.
prevalence rate of antenatal depression was 65%. Can you even imagine? Now, the pooled prevalence has been reported to be 15 to 65% the world over, right? And the prevalence rate is much higher in the low middle income countries than in the high income countries. And yet, the data that I've seen during the course of my research from the low income countries is much lesser compared to what we should really be doing. But the most difficult part of the research was to realize that there is no screening tool specifically in Hindi language to capture the psychometric properties of the tool have to be such that if you ask questions in English, then to an English speaking population, uh, the response is slightly different because they are more expressive in their thoughts. And I'm not saying that, research says that in a Hindi speaking population or in this part of the world, people are not very expressive about the questions which are constructed in such a way that they capture about the feelings related to depression in the women. And women are not very expressive. So the construct has to be very specifically for a Hindi speaking population. And there was no screening tool like that. So the first part of my research, even to capture the prevalence rate of depression, was to validate the tool which is prevalent all over the world in Hindi language, and then capture the details. So that's one of the things. Now, how do we sort this issue? There are so many factors which affect depression, from candida infection in pregnant women, or in postpartum women, or even in normal women who are not, I wouldn't say normal, but in women who are not pregnant, from food and nutrition, the variables of food and nutrition, to so many other socio-demographic factors that influence or affect antenatal depression or postnatal depression, that all of these have to be studied much more, because what is affecting women in Rajasthan may not be the same that is affecting people in, let's say, Tamil Nadu. So far more research is required to understand the prevalence rates, the factors which affect, and how do we address these factors. But even more important than that is to start talking about maternal mental health issues. Because if we are not going to communicate about them openly, then we will not be mainstreaming this problem. So that is the first thing. Because mental health should not, right now it is stigmatized. But what we have to do is we have to talk about it enough so people realize that this is just a clinical diagnosis like any other. And there is a treatment possible for it. So these are the various things which have come to light. I cannot talk about the factors which influence because that's still the framework is getting readied. But screening for depression, having the right tool to screen, talking about it enough, communicating about it, and looking at the factors which affect it are very, very important issues which came to further light when I conducted my research. And women are prone more to depression than men are the world over. And many studies have, brought about this fact. So this is something that we really, really need to focus on when we talk about health in women.
Definitely, ma'am. Thank you so much for sharing all this information. It was honestly shocking for coming across all the stats that you shared about maternal mental health, and we can go on and on for discussing various reasons, but as we are really short on time, on the same note, I would want to ask you the last question, that what female health empowerment is to you, and what is your one advice to the female viewers watching this session for today?
So I would say that the female empowerment to me is going ahead for preventive health checks for yourself. You make that one pledge to yourself that you will go for preventive health checks, and not just for yourself, but for your family. Because, like I think Dr. Bhavna also said, that what is normal to you needs to be understood. So first, know yourself, know where you need to be, and then know how you will go from point A to point B. And the one advice that I would like to give to everybody is that book your health check today. And if you're pregnant or if you've just delivered, and if you're feeling blue, it's totally okay to go and speak to your doctor. And you should be freely talking about how you feel rather than just discussing the health of the fetus because you are important to you. So take yourself seriously. Thank you.
Definitely, ma'am. Thank you so much. And over to Dr. Manasi Shah, ma'am. Ma'am, what would be your one advice to all the females watching this session for related to health empowerment?
So I just would want to say one thing, that I think culturally we are taught from a very young age that sacrificing is a good thing, and that you should always put others first, and that is considered to be a good wife, a good mother. But I think we should probably like think about it and say that you should also, if not put others, if not put yourself last, at least put yourself in the same place as you put your kids or your husband or your family. Think about yourself. It's okay to be selfish and take the time out to feel good about yourself and do things that are good for you.
Uh, uh, Same question for you, Dr. Bhavna Sirohi, ma'am. What is health empowerment to you, and your one advice to the females watching this episode today?
So I feel that, empower means imparting power to someone who lacks it. So I don't think women lack power. They have amazing inner strength. And I think they should just tap into it and should not be afraid to speak up or go against injustice to themselves or to their fellow women or men, even. In leadership positions I see injustice towards men as well. So we all do. So I think we should not look the other way, whether it's injustice to a fellow colleague who's a woman or a man, or even to a patient. So I think it's very, very important for women, make your own decisions. I know it is difficult because the finances are held by, mostly in Indian society, it's a patriarchal, by men, either husband, brother, or father. But I think we have to change that. That will take a time, a societal change. But I think we need to work towards it. Thank you.
To same question to you, Urvashi Prasad, ma'am. What is empowerment to you, and what is your one thing advice that you would want to give to the female audience?
Yeah, I mean, I think I would agree with some of the views already expressed. So, with women, we tend to neglect ourselves. We tend to put everyone else first. So I think that is something we should not do, and we should also look after ourselves, not just physical health, but also our mental health and our overall well-being. That is something we must prioritize. But actually, to the men out there, I would say, like, do talk about these things with the women in your life. Do accompany your mother or your wife or your girlfriend for a breast cancer screening, and really talk openly about these issues, because there's so much stigma, there's so much shame that is often associated for no reason at all with issues which are just completely natural. So I would actually equally, send out this message to the men who are listening to this, to prioritize, the health and well-being of the women in your lives too. Thank you.
Yeah. And from your side, Sudha Sinha ma'am, what is your one advice to the females watching this session on health empowerment?
Yeah, I think I have to echo what all the other speakers have said. Be informed, know what your choices are. As women, we are used to making tough choices all our lives, and I don't think this will be any different. So, we will know when we have to make what is the right choice for ourselves. So, make your own choices.
Thank you. Thank you so much. And I thank all of our panelists for taking out time for us. I hope lots of great information was shared. I'll share my bit of the last question as well. That here at Voice of Healthcare, we feel that voicing your opinions strongly and being able to work towards making a change for the betterment of everybody around you in healthcare is our um, definition to empowerment. I wish everybody watching this a happy International Women's Day again. Stay healthy, stay safe, stay happy. Thank you so much for watching.
Thank you.
Thank you.
Thank you.
Thank you.